And KCTV5 is your back-to-school authority, and we are continuing to talk with experts this morning to get you the best preparation possible for the return to school. This morning, we are joined by Dr. Lee Norman, the Kansas Secretary of Health. Dr. Norman, good morning to you. Thank you so much for joining us.
Good morning, Joe.
Happy to have you here. We wanted to talk about tomorrow. You are set to meet with the State Board of Education to discuss the return to school and make recommendations. Right now, what are you thinking? Should they start on September 10th, as suggested yesterday by the governor, or should they move to e-learning only? What is the situation?
Well, that's a really great question. And I think that one size will not fit all. You know, we have counties where there's still a lot of steady community spread of the COVID-19 or even increasing. We have other counties that have not been impacted or the numbers are dropping. So I think that there's going to be probably some adjusting county by county and even district by district. There are a few things we do know, Joe, about this reopening. And one is that we do know the mitigating measures work. You've heard a lot about class size and spreading people out and adjusting schedules. We do know those work, but they're not perfect. We know that there is that kids under the age of 10 are less likely to spread it than those that are over the age of 10. I think that has to be taken into consideration. We know that even the schools themselves, the older ones with older HVAC systems and ventilation, for example, are a little bit riskier and must be taken into consideration. And then finally, point number 4, I think that online education or hybrid is probably more likely in those communities where there's steady transmission of the virus or it's getting worse, and that you can go to a hybrid or having more in-class classes as in the communities where it's dropping. So that's a brief summary, Joe.
And Dr. Norman, this is Gina Bullard. Governor Mike Parson just last week, he downplayed the risk for students who may get the virus, saying, you know, they're going to get over it. We have to move on. Let's not let this virus stop us. Well, this virus, like you said, it doesn't just stop at the students. Is it worth the risk sending these kids back?
Yeah, great question, Gina. I don't entirely agree with the governor, Parsons, on that. Because you're right. I mean, there are kids. We've had deaths in children. We've had very serious complications from it, and especially they do spread it, even if they themselves don't have a bad illness. So I think that would be a little bit cavalier to dismiss that as a worrisome thing. That said, we could be doing this for a long time. We could be doing this 18 months from now, and I think that we will never mitigate the risks to zero. So the question is, what are the risks that we consider to be worth taking? Because not having kids in school has its own inherent risks as well. They benefit from school, obviously, also the nutrition, the socialization. It's great for the mental health. It's important for families, helps parents get back to work. So it's a delicate balancing act, no question.
It certainly is, and it's something that we're just going to have to try to work through because it is so confusing for so many people right now. Dr. Norman, we also wanted to talk about Kansas as a state in a bigger picture here. We know that doctors at the University of Kansas Health say that Kansas is now leading the country in the highest number of new coronavirus cases per capita. When it comes to Kansas, what went wrong here? What can we do to reverse this trend? You know, I know whenever we talked back in March that there was the thought that maybe Kansas or the Midwest could be a leading example for the country. Now we are on other states' quarantine lists. Is there any fixing this?
Yes, there is. And you know, back in what seems like forever ago, March, April, even May, we were doing just great. We were in the top dozen states in terms of our numbers. And what happened on May 26th, quite honestly, is that the legislature interjected itself and it resulted in Governor Kelly's mandate for the phased reopening of the state, limiting mass gathering sizes, et cetera. And so we hit the lowest number of cases, the fewest deaths per capita at the end of May, and it's been climbing ever since. And you've seen the news clips and everything of bars opening instantly. And then again, a mandate for mask wearing. There's no question masks work. The governor's mandate for mask wearing was required to be decided on county by county. 90 counties said, you know, heck with that. We don't think masks are important. And then, so basically, the county was flung open to party down on May 26th, and it's just climbed absolutely straight up ever since. And it was exactly predictable. It's what we said would happen is happening. And there are some counties that are acting responsibly and others that are acting very irresponsibly, quite honestly. And those are the counties that are having the worst problems.
All right, wear your mask. You heard him, Dr. Lee Norman, Kansas Secretary of Health. We appreciate you taking the time to talk to us this morning.
Great. Thanks, you guys. Good to see you.
You too. Have a good day, Dr. Norman.
It's 6:20.